Today we will learn about tumor markers. So tumor markers are nothing but the molecules or substances which are synthesized and released from the tumor cells, and these substances can be detected in blood or bodily fluids, which will tell about the presence or absence of tumors in the body. So where all we can use this tumor markers? So as a basic, it can be used as a screening tool for screening cancer, for diagnosing cancer, evaluating cancer prognosis, prediction of therapeutic responses. So once a patient is put on therapy, so these tumor markers can be used for predicting the effect of therapy, and also to monitor the effectiveness of cancer therapy. So these tumor markers, few of them can be used for tumor staging, and also they are used for detecting whether there is recurrence or relapse of tumor in the body. So these are the applications of tumor markers. But we have to keep it in mind, many a times just elevation can happen in non-malignant tumors also, and not all tumors will cause a raise in the levels of tumor markers. Classification of tumor markers. They are classified based on their origin, tissue of origin, or their chemical nature. So we have oncofetal proteins, example AFP, CEA, carbohydrate antigens, CA125, CA19.9, tissue antigens, enzymes, they can act as an antigen, for example, alkaline phosphatase, GGT. Hormones and their metabolites also can act as a tumor markers, example, beta-HCG, calcitonin, ACTH. Tissue catabolic products also can act as tumor markers. A best example we have is hydroxyproline. Many proteins act as tumor markers. For example, we have immunoglobulins, Benz-Jones proteins, which are elevated in multiple myeloma. Receptors are also can be a tumor marker. For example, estrogen receptor, progesterone receptors, very common in breast cancer, HER2 or new receptors, they are all nowadays act as tumor markers. Let us see one by one. Alpha fetoprotein, abbreviated as AFP, it's almost serves as an albumin in fetus, and the molecular weight is 70,000 daltons, and the gene for this alpha fetoprotein is present on chromosome 4. A value less than 15 nanogram per liter is present in adults and a non-pregnant woman. A value above 300 nanogram per liter is often associated with cancers. So, but also we should keep it in mind, it may be seen in non-malignant liver diseases. That is, in non-malignant liver diseases, the values can also be elevated. But if the values are more than 1000 nanogram per liter, it is almost always associated with cancer, except in pregnancy. Because it is a fetal origin, so you can expect this elevation in pregnant women also. Apart from this, you should know the tumors in which this tumor marker is elevated. Commonly it is elevated in hepatocellular carcinomas, germ cell tumors, teratocarcinoma of ovary, and pregnancy with neural tube defect. Carcinoembryonic antigen, CEA. So it is a glycoprotein. The molecular weight is 1.85 kilodaltons. So these are produced by embryonic tissues of liver, gut, and pancreas. So we have two embryonic origin tumor markers. One is alpha fetoprotein, second one is CEA. So the reference range is less than 2.5 nanogram per ml. So CEA can be elevated in colorectal carcinomas where there is marked elevation of CEA. Also elevated in breast cancer, lung cancer, ovarian cancer, pancreatic and uterine cancers. So we also should note that inflammatory bowel diseases, liver diseases and heavy smokers, and also in 5% of healthy adults there will be mild elevation of CEA. So coming to one more important tumor marker, that is beta HCG, human chorionic gonadotropin. So it is also a glycoprotein. It has alpha and beta subunits, and this beta subunit is specific for HCG. So synthesized by normal syncytial trophoblasts, that is your placental cells. Reference range is less than 20 international units per liter. Commonly you should be knowing that it is also elevated in pregnant ladies. So that you have to keep it in mind. Any value above 10,000 international per liter indicates trophoblastic tumors. So the common trophoblastic tumors are hydatidiform mole, choriocarcinoma, germ cell tumors. So in all these tumors, apart from pregnancy, it is elevated. And about 60% of testicular carcinomas also secrete HCG. Cancer or carbohydrate antigen 125. So it is also called as MUSIC16, a glycoprotein with molecular weight of 10 million. So it is one of the biggest molecule identified. It reacts with monoclonal antibodies and the values are less than 35 units per ml. This is the only tumor marker recommended for clinical use in diagnosis and management of ovarian cancer. Very typical for ovarian cancers, where it's elevation, and it is also used to monitor the therapy. So these levels correlate with the tumor markers. That's why it can be used in diagnosis, in checking the effectiveness of therapy, and also in prognosis. Prostate specific antigen. So PSA, a glycoprotein with molecular weight of 32 kilodaltons, produced by secretory epithelium of prostate gland, and it is secreted into seminal fluid. So it helps in liquefaction of seminal coagulum. So it's a proteases complexed with alpha-1 antitrypsin. Reference range is less than 4 nanogram per liter. Elevated in prostate cancer and also in benign prostatic hyperplasia, a common tumor marker or parameter investigated in both BPH and prostate cancer. Coming to receptors, the common receptors, you have estrogen receptor, progesterone receptors. So let us see what is this estrogen receptor. So these are the proteins found on nucleus of breast and uterine tissues. Levels of these receptors in tissues determine a breast cancer person responsiveness to tamoxifen therapy. So if it is negative, then they have greater risk of recurrence than who are ER positives. So nowadays ER, that is estrogen receptors, are in place for breast cancer. So with this, a brief, we have noted what are tumor markers, what are the applications and different tumor markers and the conditions in which they are elevated. Thank you.